Jennifer Fitzpatrick has been a dear friend and supporter of mine for the many years I have known her. She has written one of the classic books on caregiving that was a big help to me while I was caregiving for my late wife. She has written a brand new book with a little different angle. Jennifer Fitzpatrick, welcome back. Welcome back to the
Hey,
Mike Shakeman
Mike.
Show. How are you, my love?
I'm good. I'm good. I'm happy to be back on your show.
Well, that is wonderful because I am so happy to have you here that to talk about a new way of improving caregiving and people just getting better care from the medical profession.
My new book is called Reimagining Customer Service in Healthcare. And while lay people can certainly read it, and I think that they'll see a lot of themselves in there, it's really aimed, the reader is really a healthcare professional or an administrator in a health or mental health setting.
Well, and that is important because there is a greater and greater disconnect between the medical profession and their patients, isn't there?
Well, in the last 3 years, we know what a mess it's been. There's a lot of burnout. There's a lot of compassion fatigue. But this book I specifically wrote so the health and mental health executives and professionals have some simple, inexpensive ideas on how to make their patients and clients more comfortable and how to make the family caregivers, you are a family caregiver, you know how to make them more comfortable when utilizing their services. Nobody goes to the hospital and says, yes, I get to have surgery. Or, oh, I'm so happy I get to have an MRI. I'm so glad my loved one's going into a nursing home. Nobody feels like that. There's tremendous stress when anybody engages with the health or mental health system. And so this book is all about just guiding the not just the doctors, the nurses, but also the people who run those places. How are your billing people treating the patient and the families? How is the receptionist treating them? Are they making them feel welcome and comfortable? And I think that that's something that a lot of organizations focus on. Well, we're here to fix the broken bone, or we're here to make sure the heart is working properly. But really, you get better clinical outcomes when your patients and their families are comfortable.
No doubt about it. And the other thing is and it's become more and more of a fact that providers, nurses, doctors, staff members are all suffering more burnout.
Well, there was a very, very high level of burnout before the pandemic and the very disturbing COVID-19 policies. But I think that it's just catching up even more so now because people went to work thinking that they were going to die or they were going to bring this horrible illness back. And thankfully, none of those awful projections from back in 2020 came to fruition. But we did see people walk out on their jobs. We saw people, I know nurses who said, I'm done. I'm retiring early. I'm out of this. So I think that the COVID-19 and the policies that accompanied it really transformed the healthcare system, and people are really there's a lack of trust with going into the healthcare setting. Now, there was a lack of trust before the pandemic. People were scared. They would hear news stories about medical mistakes, which actually is the third leading cause of death in the United States. And they would hear about maybe doctors or different kinds of healthcare providers maybe not being compassionate, not being able to listen. But I think because of all the changing recommendations, I mean, there was a study that Robert Wood Johnson and Harvard did, and trust fell for the CDC, the FDA, the NIH during the last couple of years. And so it's really important for providers. If we can boost trust and spend some time just simple, inexpensive things that we can do to make the patient experience better, you're going to have an easier time at your job, and your patients are going to get better treatment.
It's very hard for some people to, and I'll use it this way, divorce their caregiver, divorce their doctor, because we tend to put doctors in that exalted place, and not even Marcus Welby could stay there.
I think, Mike, really that's more of the traditionalist age group. People older than baby boomers, a lot of times, are more likely to feel that way. But the younger generations, I just got off the telephone with my dentist's office, and I was upset because I couldn't. My appointment had to be canceled because of something that was out of my control. And they're telling me that I'm on the wait list, but I've been on the wait list for about six weeks. And the way that I was treated simply on the phone with the dentist's office has me thinking, I don't care if I have to drive 10, 20, 30 extra miles to get a new dentist. I think I might get a new dentist just because of the way that I was treated on the phone just now.
Wow. That really is amazing.
And I'm sure that everybody listening can relate to some story like that.
I'm sure. Because as hospitals get more corporate, they've gotten less personal.
Well, one of the things that I want to share is there are 20 C-suite executives that I interviewed for this book, Reimagining Customer Service in Healthcare, including chief nursing officers, CEOs of hospitals, physicians at different hospitals. And there are a lot of people in power that do care about making it a better experience. And so what I recommend strongly to everybody is fill out the comment card, fill out the survey when you have a negative experience, if you're asked about it, but also let them know what they're doing well, because yes, there are some organizations that appear not to care, but a lot of them really do care and they want to improve.
Jennifer Fitzpatrick, your caregiving book is almost a textbook in how to deal with being a caregiver. Is it still in print?
Oh, of course, yeah. Yeah.
And where is that available, and where is Reimagining Customer Service in Healthcare available?
Yeah, Cruising Through Caregiving and Reimagining Customer Service in Healthcare, both Amazon, Barnes & Noble. I actually just did a signing in Virginia Barnes & Noble, actually, Mike, a little bit north to you, though. But, yeah, anywhere books are sold, or go to reimaginingcustomerserviceinhealthcare.com for more information. Well,
next time you're in the state, you let me know, and I will come just to give you a hug, because you have been a dear friend.
Awesome.
You have been a dear friend for such a long time, and I appreciated it. My wife appreciated it, and God bless you, my dear.
Thank you so much for having me on, Mike.